Fox 5 Health Watch.
Sufferers say it can feel like an ache, a stab, or a constant throbbing.
Thousands of Georgians live with chronic hip pain. Health Watch reporter Beth Galvin introduces us to two who decided to do something about it. Beth.
Amanda and Russ, hip surgery is usually the final option when nothing else has relieved the pain. Karen Suter and Len Horton both have chronic hip pain for two very different reasons. And they're both now hoping that two new surgeries will make that pain go away.
Show me how you hit it. At 39, Karen Suter says it's hard when hip pain keeps you from playing with your own son.
It feels like it's out of joint, like it's in the wrong place and it's pressing on something, and so it's a stabbing pain.
You can see this little white split here.
Is this tiny tear in her labrum, the cartilage that lines her hip socket?
The little gingerbread house is covered with sweets.
If she tries to sit down and read to Blake, her hip locks and she can't get up.
I hate saying, Mommy can't do this. That's hard to say to your child.
Karen and Len are both at the point where their doctors are now recommending surgery, but they're active and they don't want to give that part of their life up. With two new procedures, they may not have to.
Karen's surgery won't even require a major incision.
That's right.
Instead, Dr. Jon Hyman uses a pencil-sized camera scope to look around inside her joint.
I see a lot of inflammation in her joint.
Without ever opening up her hip, Dr. Hyman can clean out the joint, repair the tear, even release a tight tendon. Arthroscopic hip surgery isn't for patients with arthritis, but Dr. Hyman says it's ideal for hip injury patients like Karen.
I'm very excited for her. I believe that she's going to have a significant improvement in her symptoms, if not a complete resolution of them.
Good to see you. So they give you some medicine?
Len's trip to the OR is more extensive.
Better.
Karen is still on crutches, but crossing her fingers, she will soon be climbing on her new bike.
It's coming back very quickly, and I know I've got a long road ahead, but I'm getting there. I'm getting there.
Len Horton has had both of his hips resurfaced, and he and Karen will have to take it easy for the next few months. That will allow their hips time to heal, but they both say that the pain is gone. And Russ and Amanda, amazingly, they both say, like, right in the days and the hours after the surgery, the pain was gone.
Boy, having your life back, it's a big deal.
It is.
Now, will they be able to go back to being really active again?
They should be able to. They will not have any limitations, their doctors say, and they have both been in pain for so long that they haven't really been able to do much of anything. Right. Karen says her big goal is she wants to be 100% by the time her daughter Sydney, who is now an infant, starts crawling, because she wants to be able to keep up with her. That'll test her out.
That's for sure.
Yeah. Thanks, Ben.